Good morning and welcome to a special edition of House Call. I'm Dr. Sanjay Gupta, coming to you from CNN's election headquarters in New York. Now, as candidates vie for your vote this November, we're giving you a glimpse into the impact your vote could have on your health, from medical research to legalized marijuana and the price of your medication and your health insurance. We start with the price of your medicine. Now, Congress has adjourned till after the election without resolving the issue of prescription drugs from Canada. The House and Senate have been unable to agree on whether to allow Americans to import drugs from Canada. But some cities and states aren't waiting.
Every day, breast cancer survivor Chris Tague takes the maintenance drug tamoxifen to help keep herself cancer-free. Tague gets the drug from Canada. That's something the FDA considers potentially unsafe. Tague isn't worried.
I don't really see any issues there. I think that's a lot of political mumbo-jumbo, to be honest with you.
Canadian drugs are cheaper. What's more, her employer, the city of Fall River, Massachusetts, waives her copay and gives Tague a $25 rebate when she orders drugs from Canada.
Good morning. How are you? I'm good. What are you running for? My life.
Fall River Mayor Edward Lambert started the program. He thinks Congress has let the American people down.
Our government has protected the prescription companies over consumers. So, I know that the FDA and others might want to say, well, you're breaking the law. Well, the fact of the matter is that I think we're changing the law.
Other cities and towns have similar programs without the rebate. And at least 7 states have established procedures to help employees or residents buy drugs from Canada.
And when was the last time that you ordered?
These programs use a Canadian company to serve as a clearinghouse, like CanaRx Services, offering 90-day supplies of maintenance drugs at well below U.S. prices. CanaRx gets drugs from Canada, the United Kingdom, Australia, and Israel, wherever they're cheapest. These are all countries that negotiate national prices with pharmaceutical companies.
The United States is one of only a handful of countries that doesn't sit down and negotiate a standard price for medications. Our average savings now for the medications that we supply is over 50%. Over 50%.
The program with CanaRx saves Fall River more than $750,000 a year. That's a significant sum for a city with a $210 million budget.
I'd rather see that money going to public safety and education than going into the pockets of pharmaceutical companies.
Getting drugs from Canada has recently become easier. The U.S. Customs and Border Protection in October ended an almost year-long policy of seizing and destroying drugs imported by mail from Canada. That prompted the Ontario Pharmacists Association to worry about a flood of drugs leaving Canada and threatening to deplete Canada's drug supply. The U.S. Food and Drug Administration has a warning of its own, saying drugs from Canada are not FDA regulated, making them potentially outdated, contaminated, counterfeit, or containing too much or too little of the active ingredient. Not surprisingly, U.S. drug makers are also opposed to Americans importing drugs from Canada.
I think it's important for people to know it's a safety risk when they buy drugs from outside of the United States. The internet is somewhat of a wild, wild west when it comes to purchasing prescription drugs.
That's a claim CanaRx CEO Anthony Howard dismisses.
We get our materials in sealed containers directly from the manufacturer.
In Fall River, cancer survivor Chris Tague says she knows savings when she sees them. After all, she's the city's chief financial officer and treasurer.